This is how to use the DrugSense DSO8 Plus V3 Saliva Drug Test Kit in order to receive fast and accurate results to maintain workplace safety and compliance. It can detect 8 different drug groups plus alcohol. The DrugSense DSO8 Saliva Drug Test Kit can detect up to 8 classes of drugs, including amphetamines, methamphetamine, cannabinoids, cocaine and metabolites, opiates, benzodiazepine, oxycodone, and K2. The DrugSense DSO8 V3 Saliva Drug Test Kit is non-invasive, easy to use, and complies with AS 4760/2019. To begin, remove the contents from its packaging. Each drug test kit will come with one test cup and one collection swab. Remove collection swab from its packaging. To test, actively swab the inside of the mouth, the top of the tongue, and between the cheek and gum. Collection is complete when a red color indicator appears. After the sample has been taken, place the collective sponge into the test cup and secure the cap by pushing it down and turning it clockwise until it is firmly closed. Gently swirl the test cup, keeping it in an upright position. Peel off the label to check that the sample is flowing on old test strips. Set a timer for 5 minutes. After 3 minutes, compare the color of the alcohol strip with the color chart. If there is no color change, it means a negative result for alcohol. If there is a color change, it means a not negative result for alcohol. Compare it with the color chart to determine the estimated alcohol level. Each strip shows the result for the drug shown in the label. The first colored line should show in the control region, and the second colored line should show in the test region. If lines appear in both the control and test regions, it means the result is negative. Please note, even a faint line in the test region should still be considered a negative result. If only one line appears in the control region, it means the drug test is not negative. If no line appears in the control region, then the result is invalid. This could be due to insufficient specimen volume or incorrect testing procedures. Review the procedure and take a new test.